Going to be doing an assessment on Kennedy. First, we're going to be checking out her thorax and lungs. The first part of the assessment is I'm going to be examining Kennedy's back for presence of any thoracic abnormalities, such as scoliosis or kyphosis. I do that by feeling Kennedy's spine. Okay. Kennedy has a slight hump right here. This is just mild kyphosis. The next thing I'm going to do is be looking at the anterior-posterior diameter of Kennedy's chest. Put your arms up. So basically I'm looking from here to here. The anterior to posterior chest wall should be less than the transverse diameter, which in this case it is. The normal ratio is anywhere from 1 to 2 to 5 to 7. I'm also going to be checking Kennedy's posterior chest wall for symmetry. Okay. Feels pretty normal to me. The next thing we're going to do is do some percussion on Kennedy's back in 9 different places. We're going to start at the top, work our way down. Gradually move out to the sides. Back in and out. Okay, good. Next thing I'm going to do is listen to Kennedy's chest. I'm going to start with the back, basically the same places that I just percussed, as well as the sides and then the front. I'll be listening to all 4 lobes of the lungs. Alright, Kennedy, I need you to take a deep breath. Okay, let it out. Okay, remember not to breathe too fast so you don't hyperventilate. Breath. Again. 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 Deep breath. One more time. Going to move around to the front. Now this time, Kennedy, I just want you to breathe normal for me, okay? Very good. Kennedy's breath sounds are clear. Okay. Next we're going to be doing an assessment on Kennedy's cardiovascular and peripheral vascular systems. We're going to start that out by doing an inspection of the anterior chest wall. As you can see, Kennedy is laying down, and what I'm basically looking for is pulsations and heaves. A heave is a forceful lift of the chest. Okay. Next, I'll be listening to the cardiac sounds over the 4 pause. Next, I'll be listening to the cardiac sounds over the 4 valvular areas of Kennedy's heart. I'm going to use both sides of my stethoscope. The first valve is the aortic valve, which is the second right interspace of the heart. Then I'll be going over to the left side to listen to the aortic valve. Right? Then we'll be going to the left lower sternal. Put your hand up over your head. Sternal border. Listening to the tricuspid valve. Okay, and the last space is at the fifth interspace around the medioclavicular line, straight down, basically in the middle.